Good afternoon. My name is Shirgozi Naji, and today we will be discussing May-Hegelen anomaly. What is May-Hegelen anomaly? This is a rare disorder that is caused by mutations in the MYH9 gene, and this affects blood platelets. This disorder was first discovered by a German doctor in 1909 and later by a Swiss doctor in 1945. There is no exact moment when this disorder was found. This disease is an inherited condition. The MYH9 gene disrupts platelet production and causes the platelets to be abnormally large. The gene also disrupts normal production of the NMHHC IIA protein. Symptoms of May-Hegel anomaly includes easy bruising and bleeding gums, heavy periods, and red, purple, or brown spots on the skin, which is purpura. May-Hegel anomaly is an autosomal disorder, which means a genetic trait or condition that can be inherited, primarily from a family member. Laboratory diagnosis: key hematology and coagulation results, which includes thrombocytopenia, giant platelets, and Dohe-like bodies inclusion are found. Dohe-like bodies are seen in neutrophils but also in monocytes, eosinophils, and basophils. Special tests for May-Hegelen includes complete blood count, platelet aggregation, and the MYH9 gene test. Treatment and management. In most cases, patients with this disease do not need treatment. There are rare cases where patients with May-Hegel anomaly may need platelet transfusions to restore platelet levels due to blood loss. Most people with this disorder do not know they have it until there is a blood test done. The role of a medical laboratory technician will first you need to examine a peripheral blood smear to identify key morphological features and determine if a patient has May-Hegel anomaly. A case study for this is a 33-year-old white woman who had one pregnancy but no live births arrived at Virginia Mason Medical Center in Seattle, Washington, with severe pelvic pain, men- menor- menorrhagia, and uterine fibroids. For these reasons, she consented to undergo a lap- laparoscopic hypostectomy. Her medical history included chronic stable thrombocytopenia, which which had first been identified after a miscarriage 6 years previously. The patient's platelet count varied from 48,000 times 10 grams per liter to 61,000 times 10 grams per liter. Her medical record indicated a history of occasional mild gingival bleeding, easy bruising, and occasional hematomas, but no history of major hemorrhage and no requirement for transfusions. These are my citations for my research for May-Hegel anomaly, and this is my presentation. Thank you.